Okay, everybody, it is 2 o'clock and it looks like we have pretty much everyone on the line. My name is Mike Westwick. I'm the Communications Manager for COVID-19 with the Government of the Northwest Territories. I'll be your moderator today. As is generally the case with these briefings, there will be some opening remarks from our principals, Dr. Kandola, the Chief Public Health Officer for the Northwest Territories, and Dr. AnneMarie Pegg, the Territorial Medical Director for our Health and Social Services Authorities. After that, we'll go to a Q&A session with reporters. We'll get one question, one follow-up, and we'll go through the list as many times as we can. And without any further ado, I'll ask Dr. Kandola to turn on her camera and deliver opening remarks.
Good afternoon. I will begin with a brief update where we are territory-wide. We have confirmed one new case of COVID-19 in the Northwest Territories, and it is at a Gahcho Diamond Mine satellite worksite. The individual diagnosed is doing well. All potential contacts on site are isolated. There is no indication of further transmission, and public health is working with the company to monitor the situation. In Fort Liard, things have remained stable since Friday last week. There are no new diagnoses in this past week, and that's thanks to the aggressive contact tracing and testing by the rapid response team since the cluster was first discovered. We are cautiously optimistic that the swift early local health response will succeed in keeping the COVID-19 risk at bay in Fort Liard. And we have an entire community to thank for that. In Yellowknife, we still have not identified a source for the infection on January 15th. However, with well over 400 diagnostic tests completed in Yellowknife since identifying that case, and with no change in our wastewater signal through January 18, we have no indication of widespread COVID-19 activity or community transmission. If there are no further indications of wider transmission in the next week, we can consider this a bullet dodged. We still ask that all those in Northwest Territories should seek testing if you have any symptoms of COVID-19. And we will continue to monitor the situation and update you with any changes. These last 2 weeks have come with uncertainty and real sacrifice to keep COVID-19 under control. In equal measure, they have come with stories of strength, perseverance, and kindness. We have seen strong local leadership bolster the crisis response. Fort Liard Mayor Deneron's team has moved in lockstep with our territorial rapid response team to keep residents supported, informed, and on board. That strength and collaboration built trust and solidarity. And without trust, there would be challenges in asking people to come forward, get tested, and stay isolated to keep the situation under control. We have seen extraordinary perseverance from residents in Fort Liard. Immediately, when the threat was discovered, people got on board, stuck to the measures, and supported each other. They chose kindness over fear, action over blame, and together, they held an extremely successful vaccination campaign while continuing to follow measures to stop COVID-19 in its track. We have seen incredible dedication for people on the ground. One story to highlight is that of Floyd Bertrand, a local public health officer living in Fort Liard. He joined the response mere months ago and was an integral part of the rapid response team. Day and night, 2 cell phones in hand, he answered every call and rose to every challenge. He's transported people for testing and vaccination, gone door to door to hand out information and answer questions in Dene Zati. He split wood for elders and isolators. He arranged lodging, supported health staff with home visits and contacts. I could probably dedicate an entire speech for all the things he's done. So in a crisis, we all need people like Floyd, who are ready to go above and beyond. Floyd's story is just one of many. We owe him and many others our thanks. And in the Dear Fort Liard campaign, we are seeing the kindness of Northerners as they open their arms to support Fort Liard through this tough time. Messages of support are going out over the airwaves and across social media as part of that campaign. It's a reflection of the spirit carrying the territory through this pandemic and towards a bright light at the end of the tunnel as the vaccine campaign continues. As of Monday, vaccines have been delivered to residents in all 33 NWT communities. That's 9,471 first doses in less than a month. With the logistic and geographic challenges inherent in delivering vaccine across 1.3 million square kilometers, this is an incredible achievement. We continue to see impressive acceptance of the vaccine in our communities as our rollout continues. I want to thank local healthcare center staff, vaccine teams, community leaders, and residents for this team effort. Later this week, residents and staff at long-term care centers will be offered their crucial second dose. That means that people who rang in the new year with their first dose of vaccine, like Bruce Jonathan at Avens and Carolyn Douglas at the Jimmy Rasmus Seniors Home in Bechoco, will be fully immunized within the next couple of weeks. The next 2 shipments of vaccine anticipated in February will be used as second doses for the vaccine given to people in priority populations like Bruce and Caroline. I hope this focus on protecting our most vulnerable brings comfort to families across the North. Based on recommendations by Canada's National Advisory Committee on Immunization, communities can expect vaccine teams to bring the second dose of vaccine between 28 and 42 days after the residents received their first dose. The 4 to 6 week time between doses aligns with other provinces who are also following NACI guidelines. I would like to thank everyone for working with us as we shift schedules to meet complex challenges. In this great northern expanse we call home, it is a reality that weather and logistics will continue to be a challenge, and things will sometimes change at a moment's notice. Make sure to keep up the schedule. You'll find it at nthssa.ca/COVID-vaccine. Follow your social media, radio, newspapers, because we will also do everything we can to get the word out with as much notice as possible. And if you are in a priority group and have been unable to get an appointment, email my team at cpho@gov.nt.ca. We will continue to update our vaccine numbers by posting on our website weekly. There is a lot of work that goes on behind the scenes to make sure that those numbers are accurate. We take daily records from each vaccine site, tallied by the logistician. We then compare those records to the number of doses of vaccines that was sent to the vaccine clinic from the central storage in Inuvik and Yellowknife. Finally, we cross-reference the totals with the electronic medical records, where your vaccine is charted on your permanent record. So this is a complex, necessary work to make sure we're getting things right. As we continue our rollout, we will continue to provide weekly numbers and additional context for the public when available. We appreciate your patience as we roll out one of the most complex mass vaccine campaigns in history. I want to finish my remarks with a comment about an image which is stuck in my head from the past couple of weeks. It is a team of local residents alongside our mobile vaccine team after a long 3 days of clinic to deliver immunizations to Fort Liard. They are standing together with a table of empty vaccine vials forming into a heart in the foreground. This is an image of hope, and it's reflective of the feeling we've seen across communities as vaccines made their ways to arms. We are incredibly privileged to have the opportunity to reach immunity in the North much sooner than others. So let's seize this opportunity and beat COVID-19 together. If you do have questions about the vaccine, we do encourage you to visit our website at gov.nt.ca/COVID-19. And if you have more questions about the vaccine, talk to your trusted healthcare provider for advice. Thank you.
Thank you for those remarks, Dr. Kandola, and I'd like to offer the floor to Dr. AnneMarie Pegg if she wishes to offer any remarks today.
Hi, Mike. Thanks very much, and good afternoon, everyone. Before we get to questions, I will provide a quick operational update. As Dr. Kandola said, the situation in Fort Liard is stable, but we do continue to monitor closely and allocate resources as required to ensure that the rapid response team and the response remains effective. I would also like to echo the recognition of the efforts of many to address this situation, both residents of Fort Liard and the various staff and agencies that work together in this response. This has been a real test of our remote community response, and I believe that to date it has shown that our early planning and ongoing public health measures are really paying off in the NWT. It has shown how our rapid response team can work collaboratively with the COVID Secretariat, with other departments, and most importantly with local leadership, and that we can do this effectively. It has proven that our hard work to implement rapid testing in all the communities was well worth it, as our ability to test, trace, and isolate COVID-19 cases in any NWT community is both rapid and effective. And it has also proven that our small communities and their leaders are able to capably and effectively manage these situations as we partner to address local needs. Changing topics, I would like to give a little bit of an update on our vaccination campaign. I've been involved in numerous vaccination efforts, and I can say that this one is going extremely well so far. Our ability to get into every community in the NWT over the past 4 weeks and administer vaccine to residents across this vast territory is a great success and hopefully a turning point in the pandemic for our territory. By the end of this week, we will have completed first vaccination clinics in every community and will be starting second doses for some of our most vulnerable residents. We are aware that there are likely individuals who were unable to get their vaccine during this first round of clinics, either because they wanted to wait or because perhaps there were no or limited appointments. For these folks, we will continue to monitor vaccine supply, and if we can, we will add more opportunities for vaccination. I would just like to stress that our full vaccine allotment has not yet arrived and continues to arrive piece by piece. More doses are coming. Everyone who is eligible will have an opportunity to receive their vaccine between now and the end of March. And we continue to balance the risk of severe disease or death against the risk of exposure in a context where we can't vaccinate everyone at the same time, as much as this is what we would like. So until then, let's keep our guard up so we can finish strong together. Follow your isolation rules, wash your hands, wear your mask, keep your distance, and never forget, if you're sick, go get tested. And please be kind to one another. Thanks.
And thank you very much, Dr. Pegg, for those remarks. We're going to move to the question and answer section of the briefing today. I did see a couple of late joiners, and I will make sure that I send copies of remarks to you guys so that you have the full availability of that for your reporting. Just a reminder, one question, one follow-up. I'm going to go through the list at least once. We always try and get through more than once, as you know, but we'll do our best with the time that we have. I'll begin with Marie Soleil at Radio Taiga.
Okay, is my microphone on?
Yep, I can hear you, Marie Soleil.
Yeah, okay. The question is for Dr. Kandola. Are you expecting to to keep the confinement period in Fort Liard as it is, or do you plan to extend it? Like, it was supposed to expire around January 30, if my memory is good.
Thank you. The order expires automatically on Saturday, January 30th at 10 p.m. And based on the response to date and based on our containment of known cases and no further transmission to our close contacts, which we continue to monitor, I'm optimistic that I don't need to extend it.
And did you have a follow-up there, Marie Soleil?
No, that's fine. Thank you.
And thank you for the question. I'd like to go to Hannah Paulson at CBC North, please.
Hi, thanks for the update. I was just wondering if, Tammy, if you can confirm whether the cases in the yard are connected to breach and isolation.
Go ahead, Dr. Kandola.
So we don't speak about specific cases. We provide the general information to the public. We find close contacts to the cases and isolate the cases. But there seems to be some confusion in the public. The one thing that I do want to clarify is that the 14 days of self-isolation was adhered to, and so that's all I can say to date is that 14 full days were provided by all the cases.
Thanks. And did you have a follow-up there, Hannah?
Yeah, I did. I guess I was also wondering whether you foresee there being any issues with self-isolation compliance, you know, if individuals from like non-isolation hubs are unable to isolate at home, you know, yet cannot afford like the associated costs of hotels. So, you know, Fort Smith, Hay River, Inuvik, and Yellowknife, those residents have the luxury of, you know, isolating at home if they choose to travel, whereas other communities don't necessarily have that same privilege. Yeah.
So thank you. We were on January 5th, the terms of agreement would change around what would receive financial coverage in terms of isolating in the isolation hubs. So if it's travel that's medical travel or for compassionate exigent reasons, or if it's students, there is coverage of isolation costs. But when it comes to non-essential travel, there is no provision for coverage of the isolation costs. But one of the messages we just need to let people know is that it's really important that people can safely isolate. And if there's any concerns or issues in their ability to safely isolate, if they're going back to a large family or they don't have the means to safely isolate, we need to hear from them sooner than later. They need to address their current concerns to protect NWT, and each case will be evaluated, but we need to know that people can safely isolate.
Yeah, and Hannah, I would also invite you to send any follow-up questions you have on the policy you're speaking of to me as well. We can speak to it from a policy perspective as well, as these aren't part of the public health orders per se.
Okay.
And yeah, so just feel free to pass it along to me, no problem. I'd like to now go to Moira Warburton with Reuters, who's joined us today. Go ahead, Moira.
Hi, thank you for taking my question. So you kind of already touched on this in your remarks, Dr. Kandola, but given that the NWT has vaccinated a much higher proportion of its population than the southern provinces, and that it has roughly the same amount of, that it's given out roughly the same proportion of doses that it has received as the southern provinces, this seems like a pretty successful vaccine rollout. So I'm wondering if you can, and again, you kind of touched on this, but I'm wondering if you can kind of concisely sum up what you specifically think the factors are that went into that. And I'm also wondering when you expect to finish the vaccination campaign in NWT.
Thanks for that, Moira, and I'm going to give Dr. Kandola as well as Dr. Pegg chances to comment on this as well. Go ahead, Dr. Kandola.
So there's been, first of all, we released an NWT vaccine strategy on the first week of January, and it's really important that you review the strategy so you have an idea what the approach was when we were starting. There was an incredible amount of planning that went into this vaccine rollout, and Dr. AnneMarie Pegg can talk about that. But this planning started occurring in December, way before our initial shipment came. People worked through the Christmas holidays so that when we did get our shipment in December 28, it was focused. They were working with communities to develop where they're going to roll out their plans, and we had a strategy in place. One of the, in terms of our strategy, we knew we were getting not enough. We're going to get a full shipment by the end of March to immunize up to 75% of our population. But the initial shipments, it was really important that we targeted to priority populations, which is outlined in the strategy. Our aim with initial shipments was to decrease severity and decrease the impact on the healthcare system and to reach the most vulnerable populations. So when you combine all that together, what you'll see is that a most vulnerable population with the long-term care facilities and the staff that support them. So that was our first priority. After that, we focused on small communities where there is no permanent health center or nursing staff on site, and communities that were mainly flying all around. So those are pretty vulnerable communities. So we started out with the ones with the not so strong health infrastructure. After that, we moved
this is a worst nightmare scenario in a virtual briefing. We appear to have lost Dr. Kandola for a moment.
Further down, we moved to communities that had smaller communities that were not as connected to isolation hubs. And then finally, we went into the isolation hubs. So that was our strategy, was to try to get the most vulnerable. And in the regional hubs, we focused on the priority populations as outlined in the strategy. I'll let Dr. Pegg talk about the specifics on the amazing coordination of operations to roll out all these teams, the mobile teams. But this was the strategy part. Thank you.
Okay, and go ahead, Dr. Pegg. I just want to. Did everybody get a chance to catch everything Dr. Kandola said? I don't know how much people lost there.
I think I got most of it. Thank you.
Great, thanks. Go ahead, Dr. Pegg.
Yeah, just again to echo those remarks, we've had so many staff who've gone above and beyond during the rollout of this vaccination campaign that, I mean, I don't even have the time to list them all and to give them the recognition that they deserve. But the coordination of getting the complex cold chain requirements, as well as the sheer geography of the territory, I think speaks to the incredible coordination efforts and cooperation that the vaccination teams had with local communities in order to find accommodations and provide food and all of the support that goes around being able to roll out that vaccine. And also really the community efforts to promote vaccination, the local leaders stepping up to be vaccinated first, community initiatives aimed at answering questions about vaccination. It's just, I think all of those things are really contributing. We had a great deal of organization and skill set that originated here with the vaccination teams, but it wouldn't have been successful without the buy-in from the community and without the support of people who went out and answered questions and really made efforts to make sure that people knew that the teams were coming and that questions were answered. So I think that has been probably one of the biggest indicators and biggest links to our success, and that's why we've been able to get this high rate of vaccine out of freezers and into arms. Thanks.
I would say the team effort part can't be overemphasized for sure. Thanks, Dr. Pegg, and thanks for your questions, Maura. I'm going to move to Emily Blake at Cabin Radio now for a question and follow-up. Emily Blake, have you joined us? Okay, we're going to move then to Blair McBride at Northern News Services.
Can you hear me?
Yes, now I can, Emily. Go ahead.
Okay, yeah, sorry. Kind of switching over from vaccines, we're still getting complaints from people that they're having trouble getting through to 811 or that they're being given inaccurate or conflicting information from operators. What's being done to address those concerns?
Emily, so I can speak to that from the COVID Secretariat's perspective here. Certainly we regularly follow up with our staff. There's standard training procedures in place. We have strong manuals. In any workplace, you're gonna have some issues pop up, and what we're dedicated to is making sure we address those right away. We take the commitment to getting good information out to folks in a quickly changing situation very seriously, and what we would say is that we're very dedicated to dealing with those issues when they do arise. I would say that if anybody is experiencing any technical issues, to our knowledge, they have been resolved. There shouldn't be folks who are having their calls dropped at this point. So please do email protectnwt@gov.nt.ca and describe the problem, because we really don't want that to happen. Follow up for you there, Emily?
No follow-up.
Okay, thanks a lot. We'll move over to Paul Bickford at the Hay River Hub.
Thanks, Mike. This is a question for Dr. Kandola. Dr. Kandola, the COVID-19 signal in the wastewater here in Hay River has disappeared, of course, but just wondering, is there any way to 100% confirm that that's related to the case in Fort Liard, or are you still looking at where that signal came from originally?
Thanks, Paul. So when you look at the wastewater surveillance, it's going to be impossible to link a specific signal to a specific person, because basically we take the entire wastewater of that community and we look for any debris of COVID virus and amplify that many, many times to get a signal. The only thing that we can do and say is that as all of the original cases had left and no longer were in the Hay River, that signal went down to no detects, and we can continue monitoring the situation. The wastewater surveillance is our early warning system, so the signal may be at no detects, but 2 weeks from now, anyone can come in and shed virus, and we're always monitoring and trying to decide, is this an anticipated signal? Do we have a known case of COVID in that community? If we don't, we tend to try to do an aggressive outreach, similar to what we've done in the Yellowknife in the past. Because at this point, there's no detects, and we've literally called out for a lot of testing, it is our belief that this was related to the Fort Liard cases, and we will, as always, continue to use wastewater surveillance as our early warning system.
Okay, thank you. And there may have been a question earlier from another reporter about this. I didn't quite catch the question, but I may have a similar question, so forgive me if it's the same question. If it's believed to be related to the person from Fort Liard who's self-isolated here, are there going to be any reconsiderations of some of the rules regarding self-isolation? Because basically that person may have been here, slipped through the process. Is there going to be any consideration for longer self-isolation periods or testing before people leave self-isolation, that sort of thing?
I'd first caution you on using the term slipping through the process there, Paul. I think Dr. Kandola has been pretty clear about the fact that 14 days of self-isolation has been completed. I'll let her finish off the comment.
So we're always, we're really fortunate in the Northwest Territories. We have a number of layers of protection. First of all, we have travel restrictions, we have mandatory self-isolation, we have the wastewater surveillance, we have we have rapid testing, we have point-of-care tests, we also have rolled out, and I think we're probably over 10,000 vaccines as of right now, reaching our most vulnerable. And so there's always ways to try to pick up early cases as much as possible. One scenario that I have introduced is the availability of testing on day 12 for anyone who's finished their isolation and going back into the community, that will test them and offer them testing before they leave. But it's not mandatory, but this is another layer of protection I've put in place. And overall, I think NWT has been really fortunate that these many layers of protection has not led to community transmission. And that's what I hope to continue. Thank you.
Thanks for the questions, Paul. And we're going to move over to Mariah Caruso at CKLB Radio.
Good afternoon. Thank you. With the recent delays to the vaccine Pfizer entering the country, have there been any talks or plans on rerouting or redistributing Moderna to other provinces and territories at a greater risk?
So when there's been discussion of prioritization of vaccines, they had has a federal and provincial first ministers, when they looked at those who were most vulnerable, the 3 territories in and of itself were identified as being vulnerable. The way long-term care is vulnerable, the way healthcare workers can be vulnerable to infection, because of our remoteness, because of our infrastructure, and because of the access we need, and we rely on the South in terms of needing ICU support or additional specialized care. I bet the best approach would be to provide vaccines to the 3 territories to allow us to immunize as much as the population as much as possible, so we don't further strain not only our own health resources but those of the southern provinces. There's been no indication by anyone that our Moderna shipments will be redistributed in any way. There's a commitment to continue providing a full allotment. In February, 3rd or 4th shipments, we need them for our second doses. These people need the second dose to be considered fully immune. So that's what the 3 territories will be relying on, and that's what the federal government is committed to, and there's been no change in that. Thank you.
And one follow-up for you, Mariah.
Yeah, I apologize. This one's kind of a little 2-in-1, but you can choose to answer one if you like. I'm curious to know, do we know where the individual had traveled from for the new case that's been confirmed? And if so, how many contacts are being traced right now?
Go ahead, Dr. Kandola. And to be clear, Mariah, you're referring to the one identified at the satellite work site, correct? In the recent public health advisory that went out. Great. Go ahead, Dr. Kandola.
So this is not our first introduction of a COVID-19 diagnosis in our mine sites. They have an excellent screening system, inbound and outbound, and for those who are symptomatic. Typically, COVID-19 diagnoses are usually for the out-of-territory travelers, but there has been an instance where it was a local. The investigation is underway, and history is being undertaken, but to identify any close contacts, and that's all I can say. This is a relatively new diagnosis that we're informing everyone, and when the investigation has any updates, we'll provide them. But so far, it's well contained.
Thanks, Dr. Kandola. And we're going to move to Blair McBride at Northern News Services.
Yes, can you hear me?
Loud and clear, Blair, go for it.
Okay. Yeah, thank you for putting this together today. My question is related to the progress of the vaccine schedule. So the clinic in Yellowknife was originally for individuals age 75 and older, and then it was brought into people 60 and older, and then it was brought in yesterday even more to include people in high risk categories, and then today it was extended again into Friday and Saturday. So does this mean that what does this mean for the schedule, and does it mean that we're ahead of schedule?
So I think I'll give both Dr. Kandola and Dr. Pegg an opportunity to comment on this, and Dr. Pegg's up on the screen, so go for it, Dr. Pegg.
Sure. What it reflects is the balance between vaccinating those people who are really at the highest risk. So older people, we know that the highest risk of severe disease and death is for people who are over the age of 60. And for those people who have the highest risk of exposure, as well as potentially a medical condition that puts them at higher risk. And the reason for the progressive opening of the vaccination clinics has been really as we evaluate our vaccine supply, as vaccines come in from communities that are finishing up their campaigns, at least the first round, and as we tally at the end of each day how many doses remain, then we have sometimes been able to expand the number of appointments that's available to some of those higher risk or wider rollout of vaccine for the higher risk groups. So it really reflects the dynamic nature of the vaccination supply that we have here. As I mentioned, we would love to have been able to vaccinate everyone all at the same time, but with the way the allotments arrive, we need to make sure that we are able to vaccinate anyone who makes an appointment, and also make sure that we're keeping vaccine numbers available so that when further allotments arrive, we're able to use those to give these people their second dose. Dr. Kandola, if you want to add anything to that.
Sure. So from a public health risk assessment, I'm so grateful that everyone 16 and older in the Northwest Territories has been offered a vaccine. When we look specifically at Yellowknife has no active cases of COVID diagnosis right now. But we do have people who are not 60 that have chronic conditions that put them at high risk of severity. And these people are going from a place like Yellowknife with minimal, no cases, to higher risk situations. And specifically, we're looking at people who have these severe chronic conditions who are going to med travel up until March 31st. People who are working in closed camps where there's a lot of outer territory workers, such as the mines, such as closed construction sites. Other scenarios, people with these chronic conditions who work in the south, who are working as flight crew or truckers. So there are this risk category, which is increased risk of exposure and increased risk of severe disease, that we're trying to get as many people as possible, not because there's a risk within Yellowknife, but because of the nature of their exposure, they're incurring their risk either at their work site or when they go down south.
And thank you, Dr. Kandola and Dr. Pegg. And was there a follow-up there at all?
Yes. So, I mean, does this reflect on the schedule? Like, was this expansion of criteria, was this anticipated? Does this mean that we're ahead of schedule?
It was anticipated in that we always planned on vaccinating those groups as priority. In terms of ahead or not of schedule, we have done an amazing job at getting vaccines into our priority populations. And we have been able to roll out a bit of a wider net, I suppose you could say, in terms of getting those priority populations vaccinated a bit quicker than the initial vaccine plan accounted for. But, you know, again, we're limited by the arrival of doses in the territory.
Yeah, key message there being that the schedule is by no means static, and we're going to have to roll with some punches as it all rolls out, of course. Thanks for the questions there, Blair. I'd like to go to Bailey Morton at True North FM, please.
Hi, Mike, and thank you everyone for your time. I don't know if I missed this during the remarks, but so has there been a second delivery of vaccines, and how many doses does that mean that NWT has available?
So, thank you, Bailey. I can respond to that. In NWT, we've received 2 shipments of vaccine doses. So each shipment was 7,200 vaccines. So we had a shipment December 28, and we had one the week of mid-January. And so in total, for our rollout, we had 14,400 vaccine doses.
One follow-up there for you, Bailey?
Yeah, thanks, Mike. I think this is what Blair was touching on. But so I think Dr. Pegg was mentioning this on the calculation between giving as many people first doses as possible while making sure you have enough for those same people to get second doses in 28 days. So do you anticipate that everyone who has their first dose now will be able to get their second dose based on the shipment schedule you've been given?
Yes, is the short answer to that. There are doses allocated for the long-term care population and staff to start getting their 4-week dose this week, as it's been 4 weeks, and with the planned arrival of future shipments of vaccine, people should be able, who have received a first dose, to receive their second dose within the recommended window.
Great. Thanks for your questions there, Bailey. One more on the list for our first go. Mario DiCiccio from Radio Canada. Pardon me. Go ahead.
No problem. I'll make it easy. I actually don't have all my answers have been questions have been answered. So thank you, everybody.
That's fantastic. Great to hear. So we're going to go back to the top of the list, and that brings us to, actually first, was there any late joiners who I missed? Is there anybody who hasn't had a chance to ask a question on the line? Hearing none. So we're going to return to Marie Soleil at Radio Taiga, and she had a question she'd like to offer from the chat. So go ahead and cut some tape.
One of the questions I asked in the chat has already been answered, but I have another one. Like you said, you received like 14,400 doses of vaccine so far. That's about 25% of what you're supposed to receive total. When are the next one coming, and how many will you receive?
So we're anticipating 2 more shipments in February, and those 2 shipments would provide the second doses for the first 2 shipments. And so one will be the first week of February, and the next one will be the last week of February.
Great, and a quick follow-up from you there, Marie Soleil.
So you will receive another 7,000 something first week of February and 7,000 last week of February. Do you have any worries about shortage before you can provide a second dose to everybody?
So when we rolled out our first 2 shipments, the aim was to follow the recommendations in the NWT health strategy and reach our priority communities and our priority populations. The aim for the first shipments, again, is to decrease severity and impact on the healthcare system. So I'm pretty comfortable with how we've rolled out and how many communities we've rolled out, that we've made a significant impact on anybody who develops COVID impact in the healthcare system. So I am pretty happy about that. And we'll need to reserve those doses in February for their second dose. But people have to remember in NWT, we have one of the lowest COVID diagnoses in the country. Our 5 active cases are in the Decho in the Fort Liard, and they will be considered recovered shortly, which will bring us back to just a minimal impact here. We can wait till March to provide the vaccine to the rest of the population. Everybody in NWT will have the opportunity to be offered the vaccine. And this is a scenario where the rest of the southern provinces are not going to be able to roll out the way we are until later in the spring.
Great. Thanks for your questions, Marie-Soleil. And I'd like to move to Hannah Paulson at CBC North for another chance here.
Hi, I just have one more question. I was kind of curious about the recommended timeline for a second dose of Moderna. I'm assuming that 28 to 42 days falls within the current recommendations for, like, after the first dose to receive the second dose. I guess I was just wondering if you can speak to, like, how effective receiving the vaccine within that time frame would be versus after that time frame, if that makes sense then.
That's an excellent question. The NACI were able to procure data from Moderna and look at in the clinical phase 3 trial, there were a number of people who had their second dose delayed. They were able to get data and look at the efficacy and could say between 28 to 42 days, we know that there is good data on efficacy. After 42 days, they don't have so much data, so they can't comment either way. And so what most provinces have done is, because we have data, we have that flexibility between 28 to 42 days, we would stick with the NACI recommendations. This is also recommendations made by the Centers for Disease Control in the US and for other countries around the world. From the 28 to 42 days based on data from the clinical trials. So we will stick to that range. And if in the future there's more data to say that you can go out past 42 days, we'll take that into consideration. But we will stick to what the recommendations are and what we have data on. Thanks.
And just a note for those who might not be dialed into all the acronyms, NACI means National Advisory Council on Immunizations. Hannah, did you have a follow-up?
No, thank you.
Great, and I'd like to give Moira Warburton another chance to ask a question and a follow-up. Moira?
Hi, thank you. I think this is pretty easy to answer, and sorry, this is mostly because I haven't been following these briefings as much as everyone else on the call, but when does NWT expect to wrap up its vaccination campaign fully? When does it expect to have the territory completely vaccinated by?
This is a really interesting question. We will, in late March, we will get our allocation that has been committed to us to allow us to offer the vaccine to the general population. And that is where we're looking at having these mobile teams, this extraordinary effort. But this COVID-19 situation is still evolving. There's some groups that are not eligible. Those are less than 18 years of age. And so we need to see the clinical phase trials that are ongoing for that population and look at ways that we can offer it to children before they start the next school year. We need to look at the variants that are occurring across the world and need to look at it, whether we're going to get a booster. But the current vaccine program, with the current allocation, we're going to be rolling it out again in mid-March, and by April we hope that everyone would have got their second dose. But it doesn't mean that we're not going to stop vaccinating, we're not going to open up to other population groups, and we're not going to we're also going to take into consideration whether we need a booster. So that information is always evolving and we're learning as we go, but the forecast looks pretty good for us for spring 2021.
Great. And a follow-up for you, Maura?
I think that's it. Thank you very much.
Thanks for your questions and thanks for joining us today. I'll go to Emily Blake at Cabin Radio for another question and a follow-up. Okay, not hearing Emily. So Mario DiCiccio from Radio Canada messaged me and said he had thought of a question. So fly away, Mario.
Sorry, I do have a question, as it turns out. I'm sure you've seen the story in Yukon of a BC couple making their way to Beaver Creek to get vaccinated. I know we have different traveling restrictions. It's not the same thing here in the territory, but can you talk about what we have in place to make sure that the people prioritized by our vaccination campaigns are actually the ones getting the shots?
I think there's probably opportunity for both Dr. Pegg and Dr. Kandola to comment here, and Dr. Kandola can start.
So if people are coming into the Northwest Territories, they can't come without, if they're not an NWT resident, they need a self-isolation plan approved before they can move from entry into the Northwest Territories. So that's the first criteria. And when it comes to the vaccines NWT, you do need a valid NWT healthcare card, and if you don't have one, they would need to be explain the situation directly to CPHO at the cpho@gov.nt.ca. So if they did show up, we would they would have to be in isolation, and this would be a breach of isolation because they are not people cannot leave isolation to go elsewhere, even for a vaccine, without an exemption. And if they do show up for some reason to go to get the vaccine, they need to produce a valid NWT healthcare card. So in those ways, they will be able to be tracked. And at that point, they would need to connect with our office to explain what their situation is. So I think it's a different scenario with the Yukon, but it does show that how people are so desperate to get the vaccine. So it's kind of a good counter argument for vaccine hesitancy. There are a lot of people who are desperate for this vaccine, and we're so privileged in the Northwest Territories that we can provide it to 75% of the population by the end of March.
And I don't know, Dr. Pegg, if you wanted to add anything on the operational front for the clinics themselves. If not, then no problem.
The identity requirements Dr. Kandola mentioned, and we aren't asking people to bring, for the priority groups in the larger centers where we're vaccinating those people first. We're not asking people that they have a condition that puts them at higher risk. Relying on the fact that people have been incredibly community-minded during the whole rollout of the campaign, but also throughout the pandemic, and that people who are vulnerable and are needing to be protected are given the opportunity to get vaccinated in this early phase of the rollout.
Thanks for that, Dr. Pegg. And there's just a fair bit of feedback there. If everybody could just give a quick check to make sure that they're muted if they aren't talking as we make our way through here. I would like to give Mariah Caruso from CKLB the opportunity to ask another question.
Thank you. Mine so much more has to do with clarity. Did you say that the case at the Gacho Quay was considered locally contracted? If not, where did the individual come from?
Go ahead, Dr. Kandola.
This is it's an outer territory worker, and that's pretty much as much information that we provide. It's what we anticipate. Importation risk is so high. Their active cases are happening in all the southern provinces. So we do anticipate that people traveling outside or people who are coming in to work from outside of NWT can bring COVID in. And we provide testing at that site to pick them up, both inbound and outbound. And if people are symptomatic, these are the precautions we put in place. We are not here to eliminate the risk of importation. The whole focus has always been is to pick up these cases, isolate them, get their contacts, isolate the contacts, and prevent community spread.
Thank you.
And a follow-up for you, Mariah?
That's all for today. Thank you.
Okay, thank you. We'll head over to Paul Bickford at the Hay River Hub.
Thanks, Mike. This is a question for Dr. Kandola. Dr. Kandola, have you noticed any decrease in the number of cases of influenza because of people wearing masks? I'm asking that because I was speaking to an acquaintance in an eastern province. They said there's a general mask mandate, and he said basically there's no cases of influenza there. So have you noticed anything like that here?
So this is excellent questions, and a question that you can actually find for yourself. If you look at the Flu Watch Weekly that's provided for all the Canadian jurisdictions, we monitor flu activity every week, and we provide that data. With the exception of like sporadic cases in the eastern part of Ontario, we have not seen a single case of flu for all the territories or the other provincial jurisdictions. One of the things that we've learned from COVID that is that washing your hands, staying home when you're sick, wearing a mask, these are all really good public health measures. You should continue even if the pandemic ceases. It's a good way to protect your workers, people at school, your family members. So once the pandemic's over, continue these measures. In the Northwest Territories, we haven't had a single case of flu, and this is something that we've seen across Canada with the exception of Ontario.
Wow. If I could have a follow-up with that, how many cases would normally be in the Northwest Territories at about this time of year?
We would see flu activity starting in a little bit in October and November. Last couple of years, it's been peaking around December, but typically when the college kids come home from university or people come traveling, we see a lot of the cases in January. In terms of numbers, we test people who are hospitalized. However, once we know there's flu activity in a community, we stop testing, and typically we have hundreds of cases of flu a year, and we can give you the exact numbers year by year. But I think this is the first in my 17 years up here, I haven't seen a single case of flu, but now we're jinxing this. So how about we say we continue to monitor the situation till we're out of our regular flu season. Thank you.
Thanks a lot.
Everyone collectively knock on wood while graciously keeping your mics muted. We have one question left. One time for one more question, and I want to give it to Bailey Morton from True North FM.
You gave me a lot of build up, and I actually don't have another question, Mike, but thanks very much.
Okay, no worries. Blair McBride then at Northern News Services.
Yes, thank you. So I read that last week the Yukon rolled out these new gargle tests for COVID-19 for young people aged 5 to 18. Is this something that might be considered introducing in the NWT? Will we receive them?
I think that's an AnneMarie Pegg.
Yeah. We are not looking at that particular test right now. What I can say is the rapid tests or the point of care tests that are available now in all of the communities that for the most part do still require a follow-up PCR, which is the gold standard done here in the hospital lab or in the UVic hospital lab. But there are rapid tests that can be done either by a nasal swab or a throat swab, not the deep nasopharyngeal swab that everyone has grown to know and love. And so as those alternate measures of sample collection get better data, and we anticipate that they will be validated, that may be looking at a sort of less invasive way to test some of the younger people that we're worried about potentially having COVID.
Okay, great. And we've reached time here, folks, and the docs have got to move on to some other meetings. So thank you all for attending today. And remember to keep your distance, wear your mask, wash your hands, and stay safe. Have a good day, everyone.